Hello, everyone. Welcome to this installation of our BDO live stream. My name is Dr. Ashanti Carter, and I serve as the Chief Academic Liaison to blackdoctor.org. All right, you guys, here we go. We are back for unity and immunity. This is going to be a powerful conversation about vaccine confidence in communities of color. So today we're tackling truth, trust, and public health at a time when misinformation is spreading faster than the facts and sometimes a little bit faster than the flu. Speaking of the flu, as we enter flu season, this discussion couldn't be even more urgent. So, our communities, especially older adults and those with compromised immune systems, continue to face higher risk from preventable illnesses. Vaccines are not our enemy. Let me repeat that. Vaccines are not our enemy. They are actually one of our greatest tools for protection, right? It's for protection, just like a winter coat. So let's talk about how we can rebuild confidence, empower our communities, and protect one another. So we have two great panelists today, and I'm going to let them introduce themselves. So I'm going to start with Dr. Shante Brown. Dr. Brown, introduce yourself to our audience.
Everyone. I'm Dr. Shante Brown. Shanti, thank you so much for extending this invitation. I'm truly honored to be here to talk to the community. I am a pharmacist for all intents and purposes. I specialize in oncology pharmacy, so I do treat cancer patients. I'm really excited to talk to you all about vaccines. I do an extensive overview for my patients and clinical review and give them vaccines according to the schedule, especially when we have our immunocompromised patients. I do a large group of vaccines for those patients. So I'm really excited to be here. And again, I love that we're talking about vaccines, especially the flu season, season, getting our boosters and things like that, and really just diving into, like Dr. Shanti said, that vaccines and immunization, they are a friend. We shouldn't be afraid of it. And I'm here to hopefully help our community break down some of those myths and get some more truth and some more confidence from faces in our community. So thank you so much for having me.
I love it. I love it. Okay, but Dr. Brown, you didn't tell them about,
Everything else I do.
Yeah,
Okay,
NPHA. Come
okay.
on
All
now.
right.
Come
So let
on
me do
now.
my plug. So I also serve, I do a lot of different things, guys. So I serve on the board of NAFA, which is the National Pharmaceutical Association. I serve as their co-chair for the regulatory and legislative community chair. So what I do is basically I partner with organizations such as Black Doctors .org and the National Medical Association, the National Dental Association, Indian Health Services, with all the minorities on pushing policies to make sure that we protect our most vulnerable populations. So making sure that you get access to these vaccines, they are really starting to strip away who can get access to vaccines. They're putting some untruths out scientifically in the community. And I want to make sure that we bust down those myths. We make sure that you get the science and you're well informed to empower you to make the best decision about your health for you and your family. So I do a lot with policy. So do a lot with that. I also teach at Howard University. I teach our brilliant minds of the future. I just finished teaching last month to the P3 students in the College of Pharmacy at Howard University. What else to do? Oh my goodness. I just started a new position actually on Monday. A senior director of Ponos Care. So basically, a provider for PBMs or pharmacy benefit managers, and we provide clinical services to our most vulnerable patients who have high inflammatory responses, and we see that high reoccurrence of emergency rates. So I work there. I just signed on Monday as their senior director of pharmacy.
Wow, Dr. Brown, congratulations or are in order to you.
Thank you.
So thank you
Thank
so
you.
much. But this is great. This is great. So let's set the landscape, all right, and let's understand the landscape.
Yes.
So what are you seeing right now in terms of vaccine confidence in communities of color?
So I think right now there's a lot of questions, and I want to stress how important questions are.
Mhm.
We welcome them. I will even just share my own story. So I really do believe in the science. I believe in over challenging the immune system. I still wanted to make sure that my children were vaccinated. So what I did was I decided that my children were able to get two vaccines, an oral vaccine at a time. Now, did that mean that I had to go to the doctor's office every month for them to get all of the vaccines? Yes, but that's okay. It's just about what you're comfortable with. I know a lot of people have a fear around, the immune response that could come from, again, giving too many vaccines at one time. It's okay to ask those questions, and it's okay to really talk to your physician, talk to your pharmacist. That's what we're here for. Questions are welcome. And I think we're seeing a lot of that. We're seeing questions as we see the measles outbreak. I think about in South Carolina, literally just happened yesterday. We have
Wow.
students that are being quarantined for a measles outbreak.
Mhm.
So we want to make sure that you understand the science behind vaccines do help lower the risk and severity, right, of outbreaks. So measles is one of those examples. So we want to make sure that you understand that if you're not vaccinated, you're susceptible to the disease or the virus is being transmitted. And
Absolutely.
yeah, and so we think about flu, we think about COVID vaccine, a lot of patients they feel like, the flu is going to make you sick. I need you to understand that it's going to challenge your immune system. It activates those your memory fighting cells to be able to put up a line of defense, so to speak, right? From
Uh-huh.
the invaders, which is going to be that flu may have some mild symptoms, right? Just mild, aches and pains that first day after the flu shot, but that mild response is really just an example of the vaccine doing its job, right? It's
Right.
really just triggering your immune system. We're by no means giving you the flu. That's not what the vaccine is doing. I
Right.
want to make sure that we break that down. That is not, we're not injecting the virus into your body. So we
Right.
have a lot of questions about that. But it really is just triggering that immune response and understanding, I don't want to get into the whole technical details of our
Right.
immune cascade right in our body, but I do just want you to understand that it is really, you think about it, it's football season, right?
Mhm.
So, right, we're building up our defensive line. That is in
Right.
essence what we're doing. We're thinking about defense and preparing for those offensive invaders, which are the flu virus, the COVID virus. So that's really what we're doing. And I just want to make sure that we stress that to the community that that is what's going on. And again, questions are welcomed. It's
Right.
okay to have questions. It's
Mhm.
okay for you to ask questions because you're not going to be able to get the knowledge if you don't ask.
Absolutely. So, Dr. Brown, have you just seen attitude shift since the COVID-19 pandemic?
Will say yes. I remember, I was actually working during when COVID first came out in 2021, 21 area when we were really figuring out, right before the shutdown,
Mhm.
and working in a hospital. And really, I'm gonna be very honest. I had concerns too. Like, like we had to get the we didn't know what was going on. We had to get a
Right.
vaccine out to protect us. And the way I looked at it is this, there's science there, and fast doesn't mean that things are done improperly. I do want to stress that. Like I
Right.
want to stress that there is science that backs this up, right?
Mhm.
There are processes and um, testing that is done to make sure that it's not going to be harmful to us and things like that. Like I do want us to understand that, but I also want us to understand too that everybody's body, their genetic makeup, their immune system will react differently. I do want to stress that. So there was some concern about that, and
Mhm.
I understand it. Um, but also we want to look at what the vaccine did allow us to do.
Mhm.
The vaccine does allow us to have that protection to from, obviously I got the booster and everything like that because I was working in the community, but it did protect me. And to my knowledge, let me knock on wood, I did not contract COVID and I worked on the reservation at the time. I worked in the,
What?
to my knowledge to this day, I have not had COVID to my knowledge. And I was tested. I worked for the federal government at the time and
Mhm.
I worked and lived on the reservation in Crown Point, New Mexico, the Navajo tribe.
Mhm. Mhm.
So that's where I was during 2021. So, I want everyone to understand that there are testing and things that we do go through to make sure that these vaccines are safe and effective. And again, it's a line of defense. So I think we moved from this period of like fear about the unknown. It's a new vaccine and X, Y, and Z, but also understanding that vaccines were not just introduced in 2021, 2020, or
Right.
2019. Like vaccines have been around for quite a long time.
Hmm.
We think about the first vaccines about around polio and measles and mumps and rubella. Like they've been around for a
Right.
while.
And
So
an enslaved person actually made sure that we had vaccines, right? I forgot
correct.
his
I
name.
can't I can't I can't remember his name, but
Yeah, starts with
yes,
an R. Yeah.
but
Onimus.
you're absolutely
Yeah, Onimus. Yeah, thank
there
you,
you
Dr.
go.
Young Ricardo.
Got it.
Yeah, absolutely. So that's good. And speaking of Dr. Young Mercado, hey,
Hey,
introduce yourself to the people,
hey,
Dr. Young
well,
Mercado.
you know, sometimes technology just does what it does, and I had to switch from my computer to my phone. So thank you so much for your patience, and thank you, Dr. Shantan Brown, for opening up and providing a lot of the same information that I was actually going to provide as well. So I'm happy to see that we are in alignment.
Yes,
So
ma'am.
Sheila Young Mercado. I am currently serving as the president and CEO of the Association of Black Women Physicians, ABWP. And we're an organization that's a nonprofit to help support our communities, to provide mentorship for those entering the healthcare field, and especially to provide scholarships, resources, and then help our physicians as they're going along through the pipeline. We are essential. And I'll say without ABWP, I would not be the type of physician I am. I'm also an assistant professor at Morehouse School of Medicine in the Department of Medicine, Medical Education, and I'm on the admissions committee for both the PA program and the MD program. So I might be seeing some of you guys in interviews this year.
All right, all right. I
Amazing.
love it. I love it. Thank you so much. And yeah, technology, it's all right, but you're right on time because the next question is for you. So, how do you define vaccine confidence, Dr. Young Mercado? And what does it mean for people to make informed, empowered decisions about their health?
Vaccine confidence for me means that we as patients take ownership of what is going in our body. So you talked about your kids. I actually did the same thing. I spaced them out, and yes, I went more often. But I actually asked the nurses, I said, okay, can you please bring me the box? And so I looked at the box and I read through what was on it. I made sure there was no thimerosal, and this was back in the early 2000s.
Hmm.
And
And what's that? What did you say? There's no what?
thimerosal.
Yes.
What's that?
Thimerosal is a mercury preservative that's
Hmm.
used
Mm.
in vaccines. Um,
Yes.
Vaccines for, I believe it's children under 6, do not
Hmm.
have thimerosal currently, but it is it's a preservative.
Hmm.
And so one of the things that we can do is actually ask our manufacturing companies, right, to just remove it. Just remove it
Hmm.
from all vaccines. I think that the HHS secretary has already mandated that. But again, we have to take ownership of our health. And that means looking at what is in it and then getting an explanation. So if your provider doesn't have time, find someone. Go by the medical schools. Just say, hey, is there a medical student who wants to provide community education and talk to my group about what's in vaccines? And, the students are so happy to always do that. And also, I think that another way to take ownership is to talk to the people you can't trust.
Correct.
So I was at a conference this past week in Washington, D.C., and we were talking about AI. And one of the things that I mentioned about how we can get in front of AI is if we create our own large language models or own small language models. And when we create those, we don't sell out.
That's correct.
Ooh, I like
Yeah.
that. I like
Because
that.
No,
Okay.
and you're
Go
absolutely
ahead,
right.
Dr. Brown. Go ahead. Jump in.
No, I was just everything that you're saying, Dr. Mercado, like it's right on point because again, to your point about AI, if we don't create our own, we'll be written out. It's code.
Mm,
If we don't create our own, then we will not be in the code. So I agree with you, and selling out is a key. I think that that's a huge thing, and I think about when you are practicing, practicing not to do that, making sure that you hold true. I say two things: remember where you come from,
hmm
right? That's the first thing. And when I tell my students, I say, listen, you have a responsibility to
Right.
learn what you need to learn and take it back to your community. It's bigger than you.
Right.
Exactly.
Every student is going to take their knowledge and take it back to their community, and you're going to see the impact. You're going to see it trickle down in ways that you can't even perceive and imagine. And then again, to your point, talking to the people that foster that distrust. Not We
hmm
have to really set out to break those barriers, right? And to make sure, because there are avenues where there may not be a Black pharmacist, there may not be a Black physician. We have to make sure that we do have allies, and
Hmm.
we get them to make sure that they break down those biases, those mistrusts. And if they really truly are an ally, they will do that.
Right. Right. That's so true. And I think that, when we talk about who is an ally, I mean, honestly, I think some of the easiest ones are the ones who grew up in our communities,
That's
right?
so true.
So,
So true.
my brother on the outside, he looks Filipino, like full Filipino, right?
Hmm.
He tells everyone that he is Black, period. You know,
Hmm.
you have to have those people who are invested, who care, who have family members or friends,
hmm
not, oh, I had an ex girlfriend, or oh, I had an ex wife, or oh, not just
Right.
things, but people who are invested, who have their godchildren, their nieces and nephews. And then even the folks who've adopted kids, right? They want to make
Hmm.
sure that their kids will be treated well when they go in.
Correct.
And they do take a protective stance. And so I think it is so important. If you guys want to know where I'm from Oakland, California, 510
Okay. I love it. I love it.
or 415. And then they wanted to make more money. So we turned into 510. But in Oakland, we were in the space where when I looked at the maps, I realized I thought it was cool where we lived. We lived by the factories, by Emeryville.
Okay.
And I thought it was cool because we could just ride our bikes through. Well, I didn't realize that we were, in the red line district,
hmm
we
hmm
line.
hmm
And I would say most of my family, we all lived in, red lined areas.
Okay.
Right, right. And with redlining, all of that, that has a history, right? So I
It
really
does.
want to, yeah, let's dive into this next section. This is so good. All right, so for you guys out there in live stream land, this is how we do it at BDO. We actually have substantive conversations. It isn't just so buttoned up and oh yes, I have this question. This is real talk, to help you as
Right.
family to be healthy. And that's what we do at blackdoctor.org. So you did touch on it, Dr. Shante, when you were talking about just the legacy of mistrust. So
Hmm.
we still have this legacy of generational mistrust toward the healthcare system. So how do we acknowledge the history, right? While creating new pathways of trust around vaccination. Take it away, Dr. Shante.
So thank you so much for that question. I think it's truly important again that I like what Dr. Sheila, what you said about utilizing our students. That's a huge way. Like, I still practice, right? I'm sure that I heard that you're practicing and you're teaching as well. So I think really just empowering our students to go out because they're in the community. They're doing the footwork right now, right? While they're in school, they're in clinicals and they're so passionate, and they have this aspire. And I think it's a way really for them to learn, to really tap into utilizing their skills that we teach them, right? They're able to apply what they're learning in the classroom into the actual real world setting, which is what we want them to be able to do. So I
Mhm,
think that's a way that we can do it. One thing. So that's education two ways. Our students are being educated and our patients are being educated.
mhm,
I think that's a huge impactful way to start. And then also too, like events like this is huge. We're reaching our community. They're seeing these faces. And also too, like you talked about. serving in these institutions that produce more Black doctors, whether that's dentists, pharmacists, nurses. And then also, I think, and this is what I've been working on as I serve on with I serve on the HECTA, so the Health Equity and Task Force with NDA in partnership with NMA and NPHA. So bringing all of us together, we all of us professionals, and I think we had a representative from every Divine Nine division on with us at the end at the HECTA. Yes, we did, and then we also had the Black nurses, we had the Black accountants, the Black lawyers. So it is all of our charge, right? So even if that is not your expertise, you know that it's National Vaccine Awareness Month, or it's National Dental Hygiene Month, or it's National Pharmacist Month. Have a pharmacist come out to your organization and talk about these things. Talk about, heart failure, talk about heart disease, talk about chronic kidney disease awareness month,
Mhm.
breast cancer, like there are ways for us to not just be siloed. And I think that we're in a time where, especially with this distrust in science and in medicine, we have to tap in. We have to really bring it back in to all of our organizations, and we have to make sure we're educating every area of the population. So I think that that's a way that we can do this, and we're starting. And I challenge anyone who wants to be a part of it to come out, join organizations like BlackDoctor.org, join the ABWP,
Hey,
AWP if you can. Sorry, I was trying to get it out, couldn't get it out. Join NAFA. We have memberships that are not just for clinicians. We have a non-clinician membership. I'm sure you do as well.
we do. We
Um, right. So
Mhm.
getting involved, like I think that this is the way we are able to educate, right? And not be siloed in just our areas of expertise. So I think that that's a phenomenal way to start.
Absolutely. And then you talked about HECTA. Tell everybody what that stands for.
Yes, so
It's
it's the Health Equity Task Force. So we started it, oh my goodness, I want to say late, I'm trying to think, was it early this year, late last year?
it
But
was
really
last
started
year. Mhm.
last year, right? And so I am very passionate about, at one point in time, all of us used to be together. There's such a rich history, and I challenge everybody on here to go and look at the history, especially in the Richmond, Virginia area, about where the Black colleges started, the Black medical schools, the pharmacy school. They have such a rich culture. We actually had our NEFA had their Black History Month celebration there. We have there's an archive there at their African American Museum,
Mhm.
and it features all of us, the Black doctors, the Black dentists, the Black nurses. It's so powerful, like just to see where we come from. Like, I know we say it all the time, like we are ancestors wildest dreams, but we really are. We are living in things that they bled, marched, and died for,
Mhm.
and really inspiring the next generation. But that's what we formed this for, to make sure that we could get back together, that we could push these policies and make changes together instead of us being siloed, having our own Capitol Hill days. I was able to go out with NDA on their Capitol Hill Day and really speak with the congressmen and women and advocate and talk about not just dental policies, but also talk about things that affect pharmacists, things that affect physicians, to better serve our patients. So that's really what
Absolutely.
it's about, and really pushing those policies that, obviously minorities are going to be at risk already. But if you start cutting for everybody, we really get cut.
right.
So,
Absolutely. Yeah. Yeah. Because people have said, like, I guess when everyone else catches a cold, the Black community, we catch the flu, no pun intended. But
right.
that's what it's about. So I'm glad that BDO blackdoctor.org, we are a part of HECTA. I am the representative.
Hmm.
So, this is great. So I want to shift because, we don't want to go over time.
No,
So,
yes.
Dr. Sheila,
Yes.
in your work, what has helped people move from skepticism to understanding when it comes to vaccines?
I
So,
being in front of people. So I
mhm.
was one of the leaders that helped to bring vaccines to some of our underserved communities, under resourced, let me say, because we were there, we were working our butt.
Yes.
In South LA, we started at Jesse Owens Park, then we went to Magic Johnson Park in South LA. And that time in line, I just stood there talking to people. What do you think? What about this? My call was, if you have any sort of condition that might impair the function of your immune system. So what that what does that mean in simple terms? It means that there's something that's messing up your immune system that's not allowing it to work.
Mhm.
Okay. And so what are those things? Liver disease, any liver disease. Okay.
Mhm.
Hepatitis B, hepatitis C. If you have any sort of, if there's like cirrhosis,
Mhm.
non-alcoholic, fatty liver disease, these are things that can decrease the function of your immune system. What else? Diabetes.
Mhm.
Mm.
Diabetes is huge. Diabetes
Mhm.
decreases the function of your immune system. What else? We have anyone who's on any sort of chemotherapy or
Yeah.
a therapy that or that decreases your immune system because you have an autoimmune disease, right?
Mm.
Mhm.
Mhm.
So
Mhm.
arthritis, rheumatoid arthritis, if you have psoriasis, if you have ankylosing spondylitis, all of those, if you have MS, anytime you're taking a medication for your autoimmune disease,
Mhm.
that basically decreases the function of your immune system,
Mhm.
Correct.
different parts of your immune system.
Okay.
Next, what else? Actually, pregnancy.
Wow.
Yes.
Pregnancy, because the baby, your body has to not reject the baby. You've got foreign DNA in you.
Right.
Mhm.
In
Right.
order to protect the baby, your body's immune system goes down. So that's why people with autoimmune diseases, when they get pregnant, the
Mhm.
autoimmune diseases sometimes go away because their body has suppressed the immune system to be able to carry.
Mhm.
And so for everybody that's at high risk, it is important to find someone that you can trust and talk about which specific vaccines you can take. All
Mhm.
right. And there are different versions of vaccines. And so
Okay.
that's the thing to understand. There's a dead vaccine,
Mhm.
a live vaccine.
Okay.
And there's a vaccine that is not dead or alive, but what it actually does is it helps your body to make the proteins necessary so that you can fight the disease. And that's the mRNA vaccines.
Yes.
I'm
So
trying
the
to
COVID-19. So yeah. Okay.
Exactly. Yes.
yeah,
Mhm.
exactly. So what it does, like the mRNA vaccine, it allows your body to see, oh, okay, this is what I need to create um, a that I need to stimulate my body to fight against. And so
Mhm.
Mhm.
that's what it does. It just gives you a very, very small piece of um, the virus so that your body can be able to do that. Okay.
Mhm.
Yeah, have that
So
immune response. Mhm.
exactly. And I think what is so important is, just, I don't want to say y'all can email me because that'll be a lot, but, just be able to find people that you can trust. Come on here,
Mhm.
come on to, to some of the other forums where folks are answering questions,
Mhm.
but get the real people. Okay. I'm not even
Right.
saying that you have to have all
Yes.
by your name, but again, people you can trust. And who are
Yes.
those people? We have wise women in our communities.
Right.
There
We have
was
advocates in our
have ab-
communities.
in our communities and who do take the time. And then the other thing I would say is, you guys, like, we need you so bad, because what I see right now is that we're our only hope.
Mhm. No
We're
one's coming to save us.
hope. And what we need to do is those classes that you see, those, EMT classes, dental hygiene classes, nursing assistant, CNA, like, you
Mhm.
guys get in there, start taking some of those classes. Or if you have your bachelor's degree, you can get a master's in midwifery. So we are going to
Yes,
need you all to train, because you know what? We're going to have to take care of each other.
we
That
are.
I'm going to another conference in Oakland in a couple weeks, and this is what I'm going to be pushing, because you know what? We can train people.
We
When
can.
we had the COVID-19 testing site in South Los Angeles in collaboration with MLK, DHS, and LA County Fire. the supervisor's office. You know, the thing that was so impressive to me was that our students showed up. Over
Right.
Hmm.
500 students, and some of them came from across the country. They're like, oh, I'm a
Yeah.
medical student here and I came to help. I'm like, perfect. Let me tell you what to do. We had
Hmm.
training videos, everything. And when people saw them, they thought that they were professionals.
Hmm.
So we can train folks, just get the basics, and then we can
Yeah.
show you what to do. All right. Because we are going to need you. This is my call. This is my call to action. Action is please hit some books. All right. Learn on video. And we are going to need each other to help each other.
Correct.
That's right.
Yeah.
Absolutely, absolutely. And Dr. Sheila was being so modest. I actually know Dr. Sheila personally, and I heard about the great work that she did during the COVID-19 pandemic, where she galvanized so many medical students. And actually, Charles R. Drew University of Medicine and Science, which is actually in the Watts Willowbrook area. I'm a Drew alum as well. And she brought together all of these students to do COVID-19 vaccines when it was first coming out. And I
Hmm.
think you guys vaccinated well over 1,000 LA residents, correct?
Yes, and they came back for their second dose. So
Hmm.
Absolutely.
the important part, over I believe it was 95% came back, and the other places weren't that high. But why was that? Because we did build trust, right, with
Exactly.
the community. And I can't be remiss without talking about my colleague in arms, Dr. Jerry Abraham. You know, we were out there. He set up
Yes. We
a
love him.
24-hour site, you know? And again, you guys, like, this is so important, especially for people who are at high risk. But here's the thing, some people may not know that they're at risk. They
Hmm.
know that they have liver disease. They might not know that they might not know that they have cancer. Right.
Right.
And so, you know, it is so important to go now, go get a checkup, go get your blood draws, get your pills, get your refills. One of the things, and I know I'm going to digress just a little bit, uh,
Okay.
but I read Project 2025
Okay.
the day after, when everybody was like, oh my gosh, and crying and weeping. I was like, oh no, we need to get into action. Let's see exactly. And I read
Right.
some of it before, but then I went into a deep, deep dive. And I let folks know, hey, they're going to be cutting stuff. They're going to cut Medicare. They're going to cut Medicaid. They're going to be, you know, lining the pockets of their friends. And so we are going to need to find alternatives. And we're
Mhm.
going to be prepared for that. And so, you know, I think it's, you know, we let our physicians know in ABWP, we let them know that they're going to be cutting DEI. That affected me directly. One of my contracts with UCLA was canceled because we were teaching humanizing medicine, right? Something simple. How to be kind to your patients, regardless of their backgrounds. That's all we were teaching.
Hmm.
And
Right.
Culturally competent care.
Absolutely. I mean, yeah, it's true. And just with that line, Dr. Sheila, it's like we're hearing all of this misinformation, from political figures, people who are actually paid to help us, right? So this now is going to go to you, Dr. Shante, because you are in that space. So how do we cut through the noise without being overly political, right? Because now it seems like it's very tribal, right?
Hmm.
Oh,
Yeah.
you're a part of, it's almost like the Crips and the Bloods, right? I'm from LA. So you have the
Right.
red and the blue, right? So if
Right.
you're not red, you're blue and we're fighting. So how but healthcare, it's for everybody, right?
It
It's for
is.
everybody. We all health is wealth. So how do we cut through the noise without being overly political?
I think the biggest thing is, to Dr. Sheila, to your point, is seeing people as humans. Like, I think that that's the biggest thing, right?
mhm,
Regardless of race, regardless of, and obviously I want to be sensitive, right, to our backgrounds, to our history, to our patient's religion. But I think seeing everyone is like, that could be my mother, that could be my father, that could be my sister or my brother or my child. So I think that that's a huge step. And also, to your point, empowering us to take care of not just our community, but also the other vulnerable communities. A lot of the work that I do is on the reservation. I work with our
Mhm.
migrant workers who are non-citizens of our country, and they're afraid. So we're going into the homes to take care of them because ICE is coming out, right? I
Right.
think that we have to find ways to navigate around all the political things, right? That is a huge thing. So I just got a contract in California, and we have a large indigenous and migrant worker community that is afraid. They're not coming out to get their blood pressure checks, to get their chronic kidney disease under control, their diabetes under control, because they are terrified.
Right.
So we have to come up with a way to make sure we take care of those populations. So that's what we're doing. And I know also with Howard Hospital, my good friend, Dr. Roger Mitchell, who's also the president of NMA right now,
Yeah. Yep.
Yay.
is
I know.
love him, love his work. He is very political. He is not afraid to stand up, for what is right. And I love him for that. And I love his wife as well. The work that they're doing is amazing. And I work with them a lot, but wanting to get back to these free health clinics, right? What
Mhm.
we used to do, you think about what the Black Panthers did with the free lunch, right? We started that, right?
And
We started that movement. And then, and then they decided, oh, we're going to get, the government said, oh, we're going to do it. And now they took it away. So I think for us, I think this has been such a learning thing for us, right? Like I've taken everything like, yes, the trials look bad, right? But I am more of a solution. How do we take what's going on and fix what is broken right now
Mhm.
and perfect it? So I think for me, it looks like when we started free lunch, they decided they were going to do it, so we stopped doing it. We can no longer do that. Relying on the system is not an option anymore. We have to create, sustain, and continue to amplify it, right? That is what we need to be doing. So we talk, and that goes to your point, educating the next generation. We
Mhm.
need technicians, we need CNAs, we need LPNs, we need RNs, we need physician's assistant, MDs, PharmDs. We need everybody on track.
Mhm.
Learn a skill. I need you to, if you all you can do is start with going to a BLS certification class, that is
Exactly.
a start.
Yes.
That is a start, because in our community, not being able to give effective life-saving basic life-saving training, like not being able to do that, if your loved one drops from a heart attack and not being able to do that, that's a problem.
Yeah.
You may not have an ambulance that can get there. We are seeing
Mhm.
rural hospitals have been closing for the last decade almost.
Mhm.
So we need to be trained. We need, and funny enough, guess who started EMTs? The Black community started that. We really have to start with educating our community and understanding that we are by no means a disadvantage. We are
Right.
by no means inadequate. We know how hard we work to get through our degrees, to get through our
Right.
schooling. When I see another Black doctor, I know that you knew it up, down, backwards, and forwards. I know you did. And we have to get our community prepared. I don't care what you do, your job is valuable. So I'm sorry, you get me ramped up, but that's
No,
just
no, that's no, no. Like I said, I mean this is good, and that's why our CEO, Mr. Reginald Ware, he created BlackDoctor.org. It's really that platform for us to help one another and to make sure that we have just wonderful information to ensure that every family is a healthy family. And
exactly.
yeah, and that's true. That's true. Now, speaking of individuals and making sure that they're healthy, you touched on it. Both of you, actually, Dr. Sheila and Dr. Shante, you touched on it. Just looking at our aging population,
Hmm.
because we think of when we think about vaccines,
Mhm.
sometimes we think about the kiddos, the little ones who have gone back to
Hmm.
school and all of that. So what are some, so this is actually for both of you, what are some
Okay.
of the common misconceptions our aging population or even those with chronic conditions may have about vaccines, and how can healthcare professionals like yourself respond with empathy and truth? I want to start with you, Dr. Sheila.
Yeah. Thank you. One quick comment on what was just said. So I actually took CPR when I was in 6th grade. I was 12. We were in Berkeley, California. It was Longfellow Elementary School, right there in Sacramento, for y'all who know. And I think that if I had not taken that, I wouldn't be a physician today.
Right.
There were things that were supposed to be done for my brother who was killed that weren't done. You know, again, just by knowing what should happen, we can make it better for him. Right. Exactly. So for our aging population, I believe that what may be the perception, and I can say from personal experience, my mom, who's 69, lives with me, and she's all the patients. Any patient that you've ever had, she's all. I'm not taking it. I'm not going today. I don't want that. Mom, this is like a $10,000 medic. I'm not taking it. No, no. Okay. So I understand. Okay. And am I going to call her non-compliant? Am I going to call? No, I'm not going to do that. I'm going to have empathy, you know, and just little by little slap something on while she's sleeping. I'm just joking. I would never do that. except the patches. We did that once. But well, you know, I lost my dad to lung cancer. So
Oh, I'm so sorry.
Yeah.
I lost my grandfather last year, so I'm so sorry to hear that.
I'm sorry, Dr. Shante.
Yeah.
And Dr. Sheila.
And so I think that for, you know, for the older folks, they just think, well, I'm old, you know, nothing's going to happen. Or if it happens, it happens. But you got to realize that, you know, you've got grandkids and like, you guys, like we're the sandwich generation. Like you got to start watching our kids, you know, eventually so we can take a break, right? So we can take a break. You know what I'm referring to. And so, you know, we need you here. It's not a whatever's going to happen. I know when you guys were younger, it was about sex, drugs, and rock and roll and, you know, partying. But you know what? We had that key around our neck and we were responsible. We came home. We did the dishes, the dinner for you. So now we need you to take your vaccinations. Which ones?
Yes.
Pneumococcal. All right.
Yes.
Take your pneumococcal vaccine that helps you so you don't get or decreases your risk of having serious pneumonia. What do you take? Have you ever seen someone who had shingles?
Yes. Oh my gosh. I've seen it. That's so painful.
It burns and
I've had it. It's horrible.
It burns. And so, you know, there's vaccines for that as well. Take it, you know, because you can get something that can cause, you know, long-term.
You can.
And so you don't. What else can you take? So, you know, I would recommend this for, you know, folks, adults as well. There is an RSV vaccine for adults.
Yes, there is. Yes.
Okay. We don't have one for kids. We have immunoglobulin, but we do have an RSV vaccine for adults. And we've been seeing that so much.
We have.
Your flu vaccine. If I hadn't mentioned that, your flu vaccine, and don't get the one that goes in your nose, just get the shot. That one is a virus, you know? When people say, just like you mentioned, oh, I got the flu, afterwards, it's not that you got the flu. Your body was reacting because it thought it was under attack. So you're tired. It's going to let you rest so that it can build up those antibodies. All right. The other thing is, you know, make sure that you stay healthy. Stay healthy, get sun, go out in the sun. You know, vitamin D is good for your immune system. And of course, everyone's going to talk about the COVID vaccine, right? Again, what happens when you're older? Your immune system function decreases. And that's called immunosenescence. Right? It's similar to another word. We won't say that word, but it's similar to another word. Immunosenescence. That just means your immune system doesn't do what it used to do. It's not as strong as it used to be. That's another reason why it's so important for those who are older. If you're above 60, okay, make sure that you're getting those vaccines. And if you're afraid of certain ones, you know, for COVID, there is a protein-based vaccine that you can take. So you
Hmm.
can ask them for the protein based vaccine. So the protein is already made. It doesn't have to be made, through RNA. It doesn't have to be, but there is that. I'm not saying that you shouldn't use the RNA one. I'm just saying if you have really concerns and you're like, no vaccine, then there is another option.
Correct.
Okay. I like that. I like that. Dr. Shante, you want to add something to what she said?
Yeah, I would also say too, I think everything that Dr. Sheila said is right on point. And I like too how you talked about all the vaccines. I will say just because I work in oncology, making sure that whatever chemotherapy you're getting, a lot of times we'll have to revaccinate. It does destroy all of your immune system, right? It destroys your white blood cells, which are responsible for helping fight your immune system, your memory cells, which is what, the immune system triggers to kind of we talked about earlier, like the football defense line. It's that trigger when they see those invaders. So just ensuring that, you know, we protect our elder population and our most vulnerable too. And then obviously a big one is going to be nutrition. Dr. Sheila, you talked about staying healthy in general, doing exercise, doing some type of movement, getting out of the house, getting fresh air, increasing, your, I love to say, our antioxidants, which are things that kind of decrease the aging process in our body. So fresh fruits and vegetables, just ensuring, because I always tell my patients, you can't expect your body, your immune system, to work for you if you're not giving it what it needs to build, those we call them the basic our cells in our body, those life units. If we don't feed those with nutrients, then it won't do us justice. And also staying hydrated. Even though it's winter, dehydration really affects our elder population. Yes,
Right.
I know that the temperature's going down, but you still have to drink your water. You still have to stay hydrated. Right. There she go. Dr. Sheila got it. You have to stay hydrated. Our body is like 90% water. We have to ensure for our immune system to do what it needs to do, it has to stay hydrated. To decrease the inflammation, we have to stay hydrated. So I just think, in totality, vaccines, yes, are important, staying healthy to keep you healthy in general, but also helping your body as well with the natural things that we can control. And also it's important to note, you know, the vaccines truly help you when if you do come in contact, like maybe you're watching your grandchildren and they
Mhm.
come home with the flu, right?
RSV.
That RSV, yes,
Mhm.
it protects you from getting a more severe strand, or a more severe complex of that disease. Like it decreases your risk of going to the hospital, developing double pneumonia. That's so important because as we age, like Dr. Shield talked about, our immune system decreases. It's just a normal part of life. So ensuring that we do all the things we can to combat. And I do know, like, Dr. Sheila, I sympathize with you. My great aunt lives with me, and she is okay. Tell my age. I'm 33, so she's turning 73 in December. I always know because we turn our years together. So she's turning 73, and she actually, she is a kidney transplant survivor. She went
Mhm.
through PD dialysis. So that's at home dialysis for our watchers, our viewers, and she was blessed to be able to get a kidney transplant. And she's had it
Wow.
now for about 10 years.
Hmm.
It's starting to decrease, so she's living with us. The kidney only lasts for a little while, but
Right.
she had obviously chronic kidney disease, went into end stage renal. But
Mhm.
she also had lifelong since I've been born, she's had diabetes. And that also
Mhm.
led to hypertension. So, really making sure we manage those diseases because she'll be like, oh, I don't want to take that. It makes me feel bad. And, I try to work with her, try to
Mhm.
work with I really do try to work with her, because I mean it does. Some of the medication, it takes a toll on your body, makes you tired, and she
Yes.
doesn't want to be tired all day, you know. And to
Mhm.
your point, she has said a lot. She's like, well, I'm gonna just go on to glory. Well, baby, you here right now. I need you to not say that. When it's time to go, believe me, I'm not gonna keep you here. I'm not gonna keep you here longer than you want to be here. But I think understanding that while you're here, do the things to help your body, do the things, because before you leave and go on to glory, there's going to be a season where we have to take care of you, and that's hard. That is hard on your family to see you in that condition. My mother battled breast cancer, and
Mhm.
she's a survivor. She's in remission, diagnosed very early. I think she was diagnosed at 49. So my mom,
Wow.
telling her age, my mom is 50. She just turned 50 this year. So she was diagnosed with breast cancer. No, excuse me, I'm lying. She's diagnosed at 45. Sorry, it's a journey.
Oh,
She was diagnosed at 40
Okay.
very early, but her
Yeah.
mother also had breast cancer as well. There's
Mm-mm.
no, so that's another sidebar. Go get
right.
tested, get your mammograms, do your due
Yes.
diligence, do your breast exams. Really just take care. Like we have to take care of ourselves. And if you don't know, take part in the free screenings, the free vaccine
That-
clinics. Like
That's right.
please, we are really ramping those up. We're doing those. You can I know probably every month you can find a free health fair where you can go get your screening, get your cholesterol check, get your A1C check for diabetes. Really just take advantage of that. Please take advantage of that. And also too for our viewers who are struggling, with or have patients who are struggling with insurance. There are
Hmm.
so many clinics that do sliding scale. They will assess your fee. If you make too much money to get, obviously Medicaid, they will assess your fees based upon your salary, and you can still go get affordable treatment.
Mhm.
That's
So
right. That's
please
right.
just yes, please don't let cost, that fear, be something that just makes you stay home and say, you know what, if I die, I die. Please don't do that. There are
No,
resources out
no.
here that you
Right.
can you
Health,
can do what you need to do
health,
to be healthy.
right. Health is wealth. Health is wealth. You can't do that.
It
So
is.
I know we're coming up on time. So with this question, and this is our takeaway. So with you, Dr. Sheila and Dr. Shante, what do you want our viewers, especially those who are hesitant or uncertain, to take away from this conversation about protecting themselves, their elders, and their communities? Just about with vaccines.
The takeaway is if you need it, get it.
Okay.
That's what the takeaway is.
If you need
And
it, get
a
it.
lot of our population needs it, even our young people, because their immune system is suppressed. Now,
Hmm.
you mentioned that you didn't get COVID. I got COVID. I got COVID bad. And I was so afraid for my mom, for my son. I didn't care about my husband. Like I gave him COVID. Okay. Like, but I knew that he's, he's strong, he's healthy. I knew about his immune system. I know how he is. So y'all don't get mad at me that I gave my husband COVID. But the point that the point is that if you need it, take it. So
Hmm.
understand who is at risk of dying if they get these diseases. Okay. And you know what,
Yes.
guys? I'm in Atlanta right now. Come and visit the CDC. Come visit the CDC because there is a chamber in there that we always see in books. But they used to have this machine that would help people, these children breathe. Come and
Yes. Iron
far,
lung.
come and see how far we have come. All right. We don't have to die from measles. We don't have to die, from these diseases. And one of the things we didn't mention was that women, who are in their mid part of their pregnancy, they
Mhm.
get the RSV vaccine.
Hmm.
Yeah.
Yes, they can.
Okay.
That's
They
so true.
that. And so then you're protecting
And they,
your if they're born in this season, if they're born December, November, December, January, February, you're actually protecting your baby because you're passing along those immunoglobulins to them. All right.
exactly.
Wow.
So and then breastfeeding, I gotta push that. If you can
Yes.
breast, you do pass on those immunoglobulins really 6 to 9 months.
Hmm.
That really passing those on, and then after that the baby their digestive system starts breaking it down. But before that they're taking all of that in. You see these
Hmm.
men on colostrum, what do you think's in there?
Yeah, it's
Wow.
immunoglobulins and antibodies. It is. Yeah.
Right.
Wow. Wow. That's
Yep.
that's that's amazing. Okay. All right,
Yes.
Dr. Sheila. Okay, so Dr. Shante, bring us home. Bring us home.
Okay. Okay.
Bring us
So
home.
what I want to say is trust is built one conversation at a time.
Okay.
If you're ready, get vaccinated. If you're ready, go out, get vaccinated. If you're not, bring your questions to a trusted clinician. Ask
Right.
questions and we will walk it out with you. We will talk it through with you. Share this stream tonight with a loved one because we're in a season where we have to, this is love. This is a love language for us.
Right.
Mhm.
Protecting our families and health is a love language.
Mm-hmm.
You know, sharing what you've learned here tonight with someone you love, be helping them get more educated, doing the research, you know, really talk with a clinician, talk with a trusted clinician, healthcare worker about your concerns. Don't be afraid. Don't sit in your fear and your silence alone.
Mm-hmm.
Let somebody talk through it with you. So that would be my takeaway. Just really, you know, and I love Dr. Gillette, you talked about you know, about pregnant women and you know, the vaccine with RSV, and you think about their getting their tuberculosis shots as well during their pregnancy. You know, I think that it's important that we talk about that. Protecting, you know, as a mother, we want to protect our children.
That's right.
Mm-hmm.
So, and that's what I think that's a perfect model. If as a mom we want to protect our children, we should also want to protect everyone in our community, protect our loved ones. And if we don't get vaccinated, it's very difficult for us to do that. It's very easy for viruses to spread. We'll start seeing measles outbreaks within our community. So I just challenge you, if you're ready, get vaccinated, get your children vaccinated.
Mm-hmm.
If again, we talked about spacing out those vaccines, that is something you can do. And I'm gonna tell you this: if there's a physician that will not do it, you find another one.
Another one.
Yep.
Exactly.
Find
Yep.
another one.
They're out there.
You are the steward of your health, and that's right. They're out there. Because I had to do that. In my big old age, and I have two children, they're 8 and 6 now, to do that. I know sometimes it can be scary standing up, but this is your life.
Mm-hmm.
That's right.
This is your life, your children's life, your spouse's life, your parents' life. This is out. And I want everybody to feel empowered. If you are fearful, you don't have to do it. Find
Mhm.
someone where you feel safe. You need to get safe, trusted, and honest care.
I
Right.
love it. I love it. And that's what we at blackdoctor.org, that's what we're about. So you guys, it's that time. So I would like to thank you, Dr. Sheila Young Mercado and Dr. Shantae Brown, just for this great conversation. And so to all of you guys out there in live streaming land, we've learned today that vaccine confidence is more than just belief in science, it's belief in one another.
Yes.
Vaccines protect our children, our parents, and our elders. So as flu season begins, now is the time to take action. Talk to your
Yes.
pharmacist, call your doctor, and make your vaccine plan today, not tomorrow, not next month, not when you get sick, today. Visit trusted sources like blackdoctor.org, the CDC, like Dr. Young Mercado stated, or your local health department for reliable information. Protect your healthy guys, protect your family, protect your community, because when we stand together, there's unity and immunity. So I'd like to thank our sponsor, Moderna, for this conversation. Moderna, you guys rock it out. They said, you know what? You don't have to talk about our products, just talk about the importance of getting vaccinated. That's what this partnership is all about. So once again, I'm Dr. Ashanti Carter, Chief Academic Liaison for blackdoctor.org. And I just want to say, stay healthy, you guys. Bye.